Around your 40th birthday, your biology subtly changes the rules. If you do nothing, you will lose 15 to 30% of your muscle mass. Meanwhile, your connective tissues begin to dry out and stiffen, turning once elastic joints rigid. But most adults walk right past this biological reality. We prioritize heavy lifting or knocking out miles on the treadmill, brushing off stretching as a passive chore meant for days when we aren't doing real work. Neglecting these tissues creates a cumulative cost. Reduced joint range of motion slows down recovery between sessions and increases the likelihood of developing chronic knee or lower back discomfort as the body begins to overcompensate for stiffened areas. This routine reframes mobility work. Instead of an optional chore, it becomes a daily diagnostic scan, a physical audit to measure recovery and pinpoint exactly where your imbalances are hiding. To run this diagnostic, we use a 10 to 15-minute routine called the non-negotiable 9, breaking down into 3 distinct blocks that test your entire kinetic chain. Using this routine as an active biofeedback loop gives you daily intel on your joints. That intel is what allows you to maintain youthfulness and avoid catastrophic injuries down the line. Phase 1 targets the foundation. We are looking directly at your ankles, your knees, and your baseline bodily awareness. We start with the squat crank. By simply sitting deep into a squat position and pausing in the hole, you instantly test your ankles and hips for stiffness. Next, you transition to the PVC pipe walk. Stepping onto an unstable cylindrical surface provides a direct mechanical release for the tissues of your feet. It stretches the plantar fascia, the thick band across the bottom of the foot, while simultaneously auditing your knee joints for lingering aches. The final move in this block is a simple standing rotational twist. This safely sweeps your lower back and shoulders, identifying day-to-day tightness before you ever touch a barbell. If your left side is locked up or your right knee aches, this base block flags the asymmetry immediately, warning you of the stiffness before you put heavy loads on those joints. Phase 2 shifts the focus to the posterior chain, hunting down tension trapped in the thoracic spine and the deep glute muscles. The first tool here is the prayer stretch. By elevating your elbows on a bench or table and sinking your chest toward the floor, you gently force the upper back and rear delts to open up, revealing any tight spots in your spine. From there, you drop into the Vernon Griffith stretch. This involves holding a deep split squat position while rotating your torso all the way back around your hip. This specifically tests a vital biomechanical link. Your body relies on the connection between your hip mobility and your spinal rotation, and this stretch measures how smoothly that torque transfers upward. Finally, you perform the scorpion rotation. By lying face down and sweeping one straight leg across the back of your body, you conduct a deep assessment for imbalances hiding in your glutes and lower back. Uncovering this posterior tightness is critical. When your hips are stiff, your lower back has to overcompensate. Clearing these areas prevents those compounding chain reaction injuries. Phase 3 is the final assessment block. Here, we push the hips and the core through their extreme end ranges of motion. You start on the floor with hip windshield wipers. While seated with your heels planted, you drop both knees from side to side. This aggressively tests both your internal and external hip rotation. By actively clearing this rotational pathway in the hips, you often find that the residual, nagging stress trapped in your lower back simply vanishes. Next is the hip 90-90 hamstring lengthen. Staying on the floor with your legs forming right angles, you rotate your chest out over your front knee to target deep stiffness in the hamstrings and the groin. You finish the routine with the T-spine floor rotation. Lying on your side, you trace your top arm in a massive arc over your head, maximizing your spinal rotation and clearing out the upper back. Executing these 3 phases in this exact order generates a complete diagnostic report. You step off the mat knowing exactly how recovered you are, with your joints fully cleared for whatever physical challenge comes next. The non-negotiable 9 builds a consistent daily awareness of your own changing physiology, rather than aiming for the static perfection of a magazine photo. When you perform these flows just 3 or 4 days a week, the biological effects compound. You sustain better blood flow, speed up your tissue recovery, and actively prevent the motor function degradation that naturally comes with age. This chart details a resistance training program designed for older adults. Maintaining your baseline mobility is the prerequisite for executing the heavy, multi-joint exercises listed here, like the chest press and leg press. You have to lift heavy to fight off muscle loss, and you need cleared, healthy joints to lift heavy safely. True fitness past the age of 40 requires a broader definition. It is no longer defined solely by max lifts or fast mile times. It is defined by the structural integrity that allows you to move freely and independently through your daily life. This daily diagnostic scan provides the structural intelligence required to carry you comfortably and powerfully well into your 70s. It represents the ultimate work ethic, the patience to audit your foundation every single day.